Good afternoon, William Hamspring. Let's begin the warm-up session. What is your medical experience like?
I've been a doctor since 2010, initially spending 4 years in the ICU, where I managed critically ill patients and honed my skills in advanced medical procedures. For the past 6 years, I've worked in the accident and emergency department, handling a wide range of medical emergencies. This role has sharpened my ability to make quick decisions and provide compassionate care under pressure.
What motivated you to pursue a career in medicine?
I became a doctor because of my strong desire to help others and make a real difference in their lives. Witnessing the profound impact healthcare professionals had on individuals and communities inspired me. Whether it was relieving pain, providing comfort, or promoting better health, these experiences were deeply fulfilling. The dynamic nature of medicine, the endless learning opportunities, and the chance to collaborate with diverse teams also drew me in. Ultimately, becoming a doctor was the most direct way for me to pursue my passion for serving others and creating lasting change.
Why did you choose OET?
As a doctor, my ultimate aim is to practice medicine in an English-speaking country such as the UK or Ireland. To attain registration as a medical professional in these nations, I must demonstrate proficiency in the English language. Therefore, I have chosen to undertake the Occupational English Test, OET, as it is specifically crafted to assess the language skills essential for healthcare professionals. The tailored nature of the OET ensures that it aligns closely with the communication demands and scenarios encountered in medical practice. By opting for the OET, I am confident in my ability to meet the language requirements and pursue my dream of practicing medicine in an English-speaking environment.
What are the current trends in your profession?
In my profession as a doctor, several trends are prominent. Telemedicine has seen a surge in allowing remote consultations. Personalized medicine is gaining ground, tailoring treatments to individual patients. Preventive care and wellness promotion are increasingly prioritized. Advancements in technology like AI and wearables are reshaping diagnostics and treatment approaches. Keeping up with these trends is essential for providing optimal patient care.
Do you have a role model?
As a doctor, I find inspiration from various sources, but if I were to pinpoint a role model, it would be Dr. Paul Farmer. His dedication to providing healthcare to underserved communities worldwide, his commitment to social justice, and his innovative approaches to tackling global health challenges serve as a beacon of inspiration for me. Dr. Farmer's work with partners in health demonstrates the profound impact that compassionate and equitable healthcare can have on vulnerable populations. His tireless efforts remind me of the importance of empathy, advocacy, and persistence in my own medical practice.
Your preparation time is over. You can now start the role play.
Good morning, Mihiraa. I'm Dr. William Hamspring. It's nice to meet you, though I'm sorry to hear you've been in discomfort. Thank you for coming in today. The purpose of our conversation is to thoroughly understand the back pain you've been experiencing. To begin, could you please describe for me how this pain started 2 days ago and what it has been like since then, including its severity and anything you might have already tried to alleviate it?
Thank you, doctor. It started quite suddenly on Sunday morning when I bent down to pick up the newspaper from my doorstep. It was a sharp, stabbing pain right in my lower back. Since then, it's been a constant deep ache. On a scale of 1 to 10, it's about a 7 when I'm moving around. I've been taking some paracetamol, but it only takes the edge off. I've been mostly resting on the sofa, which helps a bit, but the moment I get up to make tea or walk to the bathroom, the pain flares up again.
I appreciate you sharing those details. It gives me a much clearer picture. It's understandable that you're concerned, especially when simple movements cause such discomfort. Now, I need to ask some more specific questions about the nature of the pain itself. Mihiraa, I want you to tell me if you feel this pain traveling or radiating anywhere else, for instance, down into either of your legs, and whether you have noticed any accompanying sensations like weakness in your limbs, any numbness, or a tingling feeling, often described as pins and needles.
Well, the main pain is definitely centered in my back, but I have felt a sort of dull ache going down my right leg into my thigh. It doesn't feel weak, just sore. And no numbness or tingling that I've noticed. To be perfectly honest, doctor, this is what has been worrying me the most. When I felt that ache in my leg, I looked it up online, and the website suggested it could be a serious spinal injury, or even a slip disc that could lead to permanent nerve damage or disability. I'm terrified that I won't be able to play with my grandchildren or even live a normal life again.
Thank you for being so open with me about your fears, Mihiraa. It is completely natural to feel anxious when you are in pain, and looking for answers online is something many people do, but it can often lead to unnecessary worry. I want to take a moment to gently correct some of those severe misconceptions. The information you find online is often general and can be unreliable for your specific situation. Based on what you have told me so far, a serious spinal injury is highly unlikely. The vast majority of acute back pain, like yours, is muscular or mechanical in nature, meaning it's related to the function of the muscles and joints rather than a severe structural injury.
So, you don't think it's a slip disc or something that will paralyze me? It's really just a muscle strain?
That is exactly what I believe we are dealing with. Mihiraa, let me explain the likely diagnosis, which we call mechanical low back pain, or lumbago. The reason I am confident in this diagnosis is that while you have pain radiating to your thigh, which is common, you do not have the severe red flag symptoms that would suggest a more serious problem. Specifically, you have no severe weakness in your legs, no numbness in what we call the saddle area between your legs, and you have not experienced any loss of bladder or bowel control. The absence of these symptoms is very reassuring.
That is an enormous relief to hear, doctor. So, how long is this going to last? Will I fully recover?
Mihiraa, I can assure you that the prognosis for this condition is excellent. Mechanical low back pain is extremely common, and it has a very high recovery rate. Typically, we see significant improvement within 4 to 6 weeks. It is important to know that while rest can provide short-term relief, movement and simple, gentle exercises are actually the key to healing and preventing it from becoming a long-term issue. Staying as active as your pain helps to keep the muscles strong and flexible.
Okay, so what should I actually do? Should I just try to walk more?
Let's now focus on your immediate management plan, which consists of a few crucial steps to help your back heal. Mihiraa, for your pain relief, I recommend you start with over-the-counter medication like paracetamol, or you could consider an anti-inflammatory such as ibuprofen, provided you don't have any existing stomach or kidney issues. While the medication takes the edge off, it's vital that you gently resume your normal activities as much as your pain allows. For instance, short, frequent walks are perfect. However, for the time being, it's absolutely crucial to avoid heavy lifting or strenuous exercise. You might also find significant symptom relief by applying either a heat pack or an ice pack to the painful area for about 15 to 20 minutes at a time. I've covered quite a bit there. Do you have any specific concerns or questions about beginning this management plan?
No, that all seems very manageable. I can certainly do that. I just want to make sure it gets better properly.
I'm glad that sounds workable for you. To ensure everything progresses as expected, I must emphasize the importance of a follow-up appointment. I would like to see you again in 1 week, Mihiraa, to check on your progress and ensure the pain is resolved. However, it is critical that you return to the surgery sooner if your symptoms change or worsen. Specifically, you must come back immediately if you develop sudden weakness in your legs, any loss of sensation in the saddle area, any difficulty with bladder or bowel control, or if you develop a fever. Does that all make sense, Mihiraa?
Yes, doctor, it does. Thank you so much. You've really put my mind at ease.
You are very welcome. I'm glad I could help alleviate your concerns. Take care of yourself, and we will see you next week.